Hi, I'm Lainey Hunter with Enterbridge Technologies. Here today I have with me Suzanne Reid from the Mary Washington Hospital in Fredericksburg, Virginia. How are you
Hello,
doing, Suzanne?
I'm good. How are you doing?
Good. Thank you so much for joining us. I'm really excited to have you.
Absolutely. Same here.
So I want to start off, just tell us a little bit about what you're doing at Mary Washington. I know you have kind of a special job title and things that you're working on over
Great.
there. So I would love for
Yeah,
you to give our viewers a little insight into what you're working on.
sure. You're right. I have a little bit of a special gig going on over here with Mary Washington Healthcare. I am actually a project manager by trade. So I work in our IT department. And I actually was asked to join in our Innovation Council. So we have a council of people who come together every 2 weeks, and they are really interested in making innovative ideas happen at the healthcare system. So I was asked to join there because I happen to also be an agile coach, and the team really values agility. So that's where the synchronization came in. That's where it made sense for me to come on board with the council and help get those innovative ideas in action.
That's exciting. I feel like sometimes innovation and healthcare are not so synonymous, and so it's it's
Yeah.
interesting to hear this council that you guys have put together over at Mary Washington. So,
Oh yeah, exactly. Yeah, it's kind of interesting because innovation really is rooted in the empirical process, the scientific method that we all learned about back in school, where we come up with a thought, we test it, and then we analyze, did it work or did it not work? So innovation really is well rooted in and fits in healthcare very well. It's just we don't see it that often.
interesting. So, what's your specific title at Mary
My
Washington?
spe- my specific given title is senior project manager.
Senior project manager. Cool. So then what you do day to day with project management, is it separate from the Innovation Council? Do you feel like they're pretty tied together? Are they like kind of running
Um,
parallel?
Yeah, good question. So it's actually very well. So I do get assigned projects that might be a better fit for more traditional, predictable project management style, such as us bringing on new clinics, most recently we just stood up our graduate medical education or residency program, and we just had our residents start, and that was a project that I helped to shepherd on toward completion. But with Innovation Council, what's interesting is most of the time when we experience or when we get the ideas that are innovative, they often involve technology, integrating innovative technologies and how that fits in with senior project manager role in IT here.
Very cool.
Yeah.
So, in your opinion, working in healthcare, what do you see as the major challenges that healthcare is facing today in 2023?
Oh, that's interesting because a lot of our challenges oftentimes come from staffing shortages, or we find that people are doing tasks that really are repeatable, things that people could automate to help get them away from having to do sort of mundane work and getting them back to what they're passionate about. So, for example, nurses oftentimes get the ask to take care of keeping track of equipment, for example. That's not really what they're passionate about. They're passionate about being nurses and caring for people. And those are some of the challenges that unfortunately we face because they are the boots on the ground in the units oftentimes.
Yeah. So just being slogged with this not unnecessary, it's critical work, but it's not engaging or fulfilling or what nurses signed up for in the first place.
Exactly. That's one of the things, it goes a long way and it sort of feeds into that staffing shortage because it really, plays into staffing retention. I certainly wouldn't want to be a place, I wouldn't want to be working at a place where I wasn't doing what I was passionate about. Thankfully, that's not the case for me here.
So, what are some of the unique solutions that y'all have worked on at Mary Washington? I remember talking to you about a robot who
Right.
delivers medication.
We do. We do. So we have a fleet of robots. The robots are called Moxie, and our robots are through a partnership that we have with Diligent Robotics. Our robots are designed with our nurses and our staff, our pharmacy staff in mind. So the Moxie robots are programmed to learn our hospitals. And what they do is they will get a request. So they might get a request to deliver medication or deliver a sample from a unit all the way back to the lab. And what Moxie does is the nurse will be able to call on Moxie, be able to put the item into Moxie's secure drawers, and then Moxie goes on her way. You'll notice we actually talk about our robots like they're people because they also have faces and they have emojis. So, and we do dress them up from time to time to celebrate their birthdays and whatnot. But we send Moxie on to different missions, and honestly, we are saving in the millions of steps for our nursing staff and our pharmacy staff now too.
What kind of reactions have you gotten from your clinical staff since implementing Moxie?
You know, it's interesting because like anything, at first change is difficult. It's hard. It's something new. It's something that you've never experienced before. But now our clinical staff welcomes Moxie, welcomes the time savings that it has, and also it really helps them to have that predictability. We know when Moxie's coming. We know Moxie's not getting stopped in the hallway to ask a question. So it really helps to predict that service and continue that patient care value stream.
Very cool.
Yeah.
So, what other projects do you have at Mary Washington that you feel like are addressing some common issues in healthcare today?
Let's see. So we do have some projects that we're working on, and we're at the very beginning stages. But really, when we look out at the technology landscape in the industry, we see that there's a lot of focus on things like artificial intelligence and machine learning. We are wanting to harness that into concepts like a smart hospital, where we can get a lot of the mundane or repetitive work actually captured automatically, and automating that work so that a nurse or clinical staff doesn't have to worry about documenting different activities, such as monitoring the times that they've done hand washing, automating those kind of things, and getting that out there. Some of the other things that we're looking at are wearable devices to help monitor patients that might need that extra care, whether they're here or at home. And it's something we actually piloted during our COVID response back in 2020 and 2021. There are also some initiatives circled around fall monitoring. So the last thing we want is we don't want our patients to get hurt while they're here. We want them to be safe and we want them to be careful. But unfortunately, sometimes as a patient's in our facility, they are a fall risk. And you can imagine with the combination of staffing shortages and just getting people moved in and out of rooms, there are times that falls can happen. And in order to prevent that, we're actually looking at fall technology that utilizes AI to help predict when a fall is about to occur. So
Wow.
we can do that, then it's going to reduce the amount of falls and increase, the safety and the well-being of our patients so that they don't have to spend more time in the hospital.
That is really
It's
interesting.
really cool.
Yeah, AI to predict when someone is likely to fall. That is really interesting.
Exactly. Yeah, it's cool stuff.
So obviously you and I have talked pretty extensively offline, but you know that we specialize in robotic process automation here at Enterbridge, and just curious to know where you see robotic process automation fitting into some of these innovative solutions and areas that you think are ripe for implementation.
Absolutely. Yeah, I see that there's a lot of partnership that could be gained from a company like Enterbridge that really harnesses that power of process automation. Because, like I say, one of our biggest struggles is people having to do repetitive work. So, a lot of times in healthcare, the processing of patient claims can often get delayed. And it could be for many reasons, but oftentimes it's just because we get in a pattern and we try to work through a claim and might forget a piece of information, right? It's you have a large EHR or a health record, electronic health record, and you try to pull all the information you need to be able to get those claims sent out accurately so that they can be paid on time, and patients get the accurate billing that they need. So really getting to the core of, either an exchange of information from the EHR to a disparate system, like maybe a financial system or a submission system. Those are the kinds of things that I think that process automation can really help us with, because
Yeah.
we have so many, systems, and it's for good reason, right? We have systems that operate for very different functions in patient care, and being able to automate those and connect them together would be really, really helpful for any healthcare system.
Yeah, totally agree. We talked once a little bit about credentialing and how you felt the RPA could fit into the credentialing process. Would you talk a little bit about that?
So, with credentialing, there are several different aspects of credentialing that have to happen accurately, and they have to happen on time in order for us to be compliant with any of our organizations, such as JCO requirements or Joint Commission. And in order to help make sure that we have patient safety in mind, we have the correct provider credentials, we have everything in line so that we're matching up the right providers with the right care that people need. The credentialing process can be very long. And just like everything in IT moves at the speed of light, if you're a provider and you get a new credential, you have to go reapply through this process. So, with the different variables that can happen during this credentialing process, I believe that process automation can really help to pull some of this information together, because we have different systems to handle bringing in new credentialed providers, gathering all their information. We also have systems that capture any unfortunate complaints that might happen or negative experiences with any providers. And as the team does their credential review process, the nurses that are responsible for the credentialing, they are having to go to many, many different systems and pull information together in order to paint an accurate picture of how a provider is performing and if we need to give them some help. Process automation could really pull all of those systems together and mash it up with what we have, the data in our EHR, to make sure our providers are performing the procedures that they need to perform every year, and make sure that they're maintaining all their credentials.
It's more of a newer use case that I'm looking into that I feel like you're right. There's a lot of opportunity there.
I agree. Yeah, right now for us, it's a lot of paper that people are having to pull together because there's just not another way to really, platform it and put everything together.
Sure. So error rates are high and frustration levels are high, and like you said,
Absolutely.
moves pretty slow.
Yep. If you want to talk about a missed deadline, that's a place where you can miss a deadline. Unfortunately.
So, what's your advice? You're working in healthcare as, an IT specialist.
Mhm.
And like we talked about earlier, sometimes, healthcare is notoriously slow to innovate. So,
Right.
what are your main pieces of advice if someone were wanting to get started, like a healthcare organization wants to get started with process automation? Like, where do you recommend people start?
Oh, that's an interesting one. So, um, you find people that are interested in moving forward, and you put them together. That's kind of how this happened here at Mary Washington. People who were interested in making Mary Washington Healthcare a better place and innovating solutions to problems, they got together and they said, let's centralize some of these ideas that we hear about often. They're great ideas. We just never had a place to really give them that platform to talk or to really spawn or spin up new tests of change. So really, it's gathering the people that really want the innovation. They want innovation to happen. They want to solve problems to make people's work lives easier and to keep patients safe. Getting those people together, and then going and listening. That's the first step. We go every 2 weeks through our operational rounding program, and our leaders come to the front lines, and they are meeting with the nurses, the providers, the pharmacy staff, anybody that's on the operations side. These senior leaders will come to them and they'll ask, how's it going? What's happening for you? Is there something that you can recommend to improve? And each of those teams will have one item that they want to test a change for 2 weeks, and then leadership comes back to them and they investigate how it went. Did it work? Did it not work? And if it didn't work, we're okay with that because then we learn where we're not going to go. So getting all of those innovative people together to talk about that, to really escalate and let those ideas bubble up that are working well in our units, and then launching forward as a team and solving problems one at a time. That's really how to get started.
I like that one at a time approach, prioritizing. I think sometimes like digital transformation can be very overwhelming because it's like this long laundry list of things that you need to improve. So you're right,
Mhm.
just getting a list of ideas, finding the one that's the biggest pain point and prioritizing and moving forward.
Yeah, that's exactly how we've tackled our innovation steering committee because there are so many ideas. We have so many smart people that really want things to work well. And being able to really sit down and go, what is it that delivers the most value? And prioritizing that first as a team, it's getting us across the finish line a lot faster than we would if we just tried to tackle everything at once.
So what are your biggest tips for kind of implementing the change management at the end of a project, right? You've developed something, the innovation committee, feels great about it. And I guess there are a lot of steps throughout the whole process. Like you said, you're talking to people, you're getting their input, and you're kind of taking them along the journey. But what are
Mhm.
your number one tips there to get something implemented, and especially planning for slow adopters or resistance?
Right, right. So again, since healthcare is often based, actually, the health of any patient is based in science and that scientific method of have an idea, test it out, and then analyze to see if it works. That's how we approach our implementation process. So we take small pilot groups, we investigate with those pilot groups, we gather the data, and we utilize their feedback and their experience with those that are willing to share that experience with those that might be slow adopters. So we prefer to roll out either unit by unit or small group by small group so that we can implement changes more successfully through the word of mouth that happens among all of the staff that the change is being put upon.
It's very cool.
Yeah.
Well, thank you so much for kind of sharing an insight into how you guys operate. It's pretty exciting. Yeah, I'm hoping to hear of more innovation committees at large healthcare systems. Like it
Yeah.
just seems like something that we need in healthcare. So
Absolutely. Yeah, I must say that when we met at HFMA, there were people that came up and said, how do you get started? Like, I want this. I want this at my organization. How do you get started? And it was just refreshing to hear that people are interested. They just don't know how to start. And
Mhm.
our motto has always been start small. It'll take off.
Yeah, pick quick wins, pick things that you can
Yes,
show off and you're like, look how well this worked.
exactly,
Thank you so
exactly.
much for joining me today, sharing your expertise. I
Thank
think there's
you.
a lot of great things that we talked about, and I'm excited to share with our viewers. So thanks again.
Awesome. Yeah, thank you. Take care.